Hey guys, I'm going to catch you up on the lecture that I missed in class the other day. Short and sweet, but it'll get you what you need to know. Sorry I missed you, and I will see you at the review session. Alright, so let's talk about some things that are going on in the brain when things go wrong. The first one I want to talk about are strokes. Sometimes we call those cerebrovascular accidents. Basically, it's almost like a heart attack when the blood circulation is blocked, so you don't have any oxygen. And basically you're killing off brain tissue, okay? If it's a short one that doesn't last very long and you can recover from it or it's reversible, we call that a TIA or a transient ischemic attack. Ischemia is when you have low blood oxygen or low oxygen perfusion to an area. So this is something short, doesn't last long, usually recoverable. You may have heard them called mini strokes. If you suspect someone is having a stroke, the first thing you need to do as soon as you can, as soon as you even think they're having a stroke, get to the hospital. They can give them what's called tissue plasminogen activator, which basically break up a blood clot and get the blood going again, oxygen going again, and they can usually reverse or stop the stroke. But it's got to be done within the first 4 hours. So if you even suspect someone's having a stroke, get them to the hospital and get this drug started. We have some traumatic brain injuries, something that's caused you to have a head injury like a concussion. That's basically, think about a football player when you get your bell rung. That's just temporary, a little bit disorientation, a little bit of bruising, not much, and it's recoverable. A contusion is a much harder hit, a much harder when your brain's up in your skull and it's floating around in the CSF and basically it slams into the skull. When it slams in harder, causes a bigger bruise, more damage, and that's usually temporary. You can also have subdural or subarachnoid hemorrhages, and we've talked about where the arachnoid layer is. It'll either bleed and form a clot below the dura or underneath the arachnoid mater. And you want to stop this as soon as you can because basically the pressure will force your brainstem through the foramen magnum, and that's not a good thing. Cerebral edema, the difference between a hemorrhage and an edema, hemorrhage is blood, and the edema is interstitial fluid. So the same thing that causes swelling in your rest of your body, whenever you have something swollen, the interstitial fluid's basically going out into the cells and swelling the tissue. Same thing, you can also have injury because your brain is swelling, and it can also force your brain through the foramen magnum. So you want to stop hemorrhages and edema as fast as you can. And I know I'm going quick, but I've got to be at honors day in like 10 minutes, so I'm going to run through this really quick. Okay, smoking. What's going on with smoking? Smoking basically blocks the carotid artery, and so you basically have cut off the blood supply, killing the brain cells. Could result in a stroke. Your risk of having a stroke if you smoke is 1.5 times that of non-smokers, so don't smoke. The other thing, smoking also leads to thickening and clotting of the blood. So if you've got your, the way it blocks the carotid artery is basically it vasoconstricts. Basically causes it to come down, be smaller in size. So if you constricted the vessel and you're sending thick, sludgy blood through the vessel, you're going to increase your chance of a stroke. It also leads to thinning of the cerebral cortex, that outer layer of the cerebrum where the you is, your thoughts and processes. That thins out. You don't have as much cerebral cortex, and it can impair your cognitive abilities. So stay away from smoking. We tend to think about it, it's heart attack and cancer, but stroke from smoking is also a very big danger. Alzheimer's. Alzheimer's is a disease. It's progressive. It's irreversible. There's no cure. There are some treatments, but they're questionable how effective they are. Basically, it's a type of dementia. When we use the word dementia, that's a broad family of categories where you're losing your ability, your cognitive ability, your thinking, your memory, your that kind of thing. Alzheimer's is a type of that. It's actually a pathophysiologic type. There's actually part of the brain that becomes destroyed, and I'll show you a picture. You see it after the age of 60, most common, and it is probably one of the saddest things that you can watch someone go through is Alzheimer's. basically they just go away. I mean, they're still alive, they're still functioning, but their personality, their ability to remember things just starts to deteriorate. And so it's just a sad thing to watch someone go through Alzheimer's. Here's a picture of a brain, and the only way to definitively tell if someone has Alzheimer's is to do an autopsy and actually see that this is this thinning of the cerebral cortex. The brain basically is just shrinking away. So again, no cure, irreversible, progressive disease that you see in people, usually over age 60. Epilepsy. Epilepsy is just the brain short-circuiting. It's characterized with seizures, which are like convulsions. And basically you're sending out output with really no input. There's nothing causing it. Just all of a sudden the brain just kind of short circuits and starts sending out these signals. And you may have small seizures, maybe just a tick in the face, or it may be a grand mal where the entire body is convulsing. So there's varying degrees of epilepsy. There are some anticonvulsants that they use to treat epileptics. This is a normal brain, and the yellow is basically an epileptic seizure when they're having an epileptic fit, and you can kind of see this yellow is the activity. So it's just random activity all over the brain that's may or may not have a cause. There's different types of epilepsy. Just go with the brain is basically short-circuiting. What's Parkinson's? You've seen this. You usually see a palsy. It's a neurodegenerative disease. You usually see things like speech and motor impairment. I think Michael J. Fox or Muhammad Ali, they both have Parkinson's. Again, it's chronic and progressive, no cure. They think it's caused by a decrease in dopamine. And it's really common in people that have had multiple concussions. So even though concussions are short-term and are usually reversible and you get over them, if you have multiple concussions over and over and over again, the effects tend to be cumulative, and they have seen a link with that and Parkinson's. For example, Muhammad Ali was a boxer, so he had many concussions. Michael J. Fox played ice hockey and had several concussions when he was a player, and so they think that could have led to his diagnosis or diagnosis of Parkinson's. The area that's compromised is this general area here, which is around the thalamus. And so think about the thalamus is our sorting and editing center, and basically there's something going on in that general area, and that leads to the loss of motor coordination. Meningitis. Meningitis is an inflammation of the meninges, those things that wrap around the spinal cord and the brain. Your first symptoms typically are fever, headache, and a stiff neck. It can be viral or bacterial. This is the one time you'd rather have the viral version of something. A lot of times viruses are really nasty boogers, but in this case, it's actually the less severe and clears up the fastest. So it's actually, if you're going to get meningitis, you would rather have a viral version. Bacterial meningitis is quite severe, can be fatal. You certainly don't want to have that. It can cause brain damage, hearing loss, learning disabilities. But the good news is we have vaccines for it. We have the Haemophilus influenza vaccine, and we have Neisseria meningitidis vaccine. And everybody pretty much gets this one in their childhood vaccinations. This is a new one. If you haven't had it, I recommend you have it, especially if you're going in the healthcare field, and it's a good one to have. Neisseria meningitidis, the meningitis that it causes, is a really nasty disease, and you want to avoid that. So if you haven't had this vaccine, I would recommend that you get it. If you have had meningitis or if you've ever seen meningitis, it's also characterized by a rash. So if you have a stiff neck, a fever, headache, and a rash, think meningitis. Here's just a picture I want to throw in of what a subdural hematoma looks like. So basically, here's the arachnoid layer. You can see that. Above that, so below the dura, you've got this big hematoma or blood clot. Obviously, this person didn't make it since their brain is no longer in their skull. So this will be a very severe head injury. Astrocytoma. This is a type of tumor. Anytime you see the word oma, like carcinoma, melanoma, all that means cancer. This is an astrocytoma, which means it's basically a cancer of those astrocytes, those neuroglial cells inside the brain. You can get one of any of the neuroglial cells inside the brain. So when you see this word, oma, which means tumor, and then usually it's going to tell you what type of cell it is, okay? Like melanoma is the cancer of the melanocytes. Astrocytoma is a cancer of the astrocytes. That's the way we put those words together. And you can just see a very different look in the brain compared to the normal brain. So these astrocytes have basically metastasized and become tumorous. A brain abscess. This is just an infection. You guys have heard about tooth abscesses or an abscess in your skin anytime an infection's kind of gone bad. Basically, here's your abscess, bacteria, got blood, pus, whatever, and you're going to get swelling around that. And depending on how long the abscess is there and how quickly they treat it, you may or may not have a full recovery. This part of the abscess, you may actually have brain damage. That bacteria may have eaten away that part of the brain. So you want to treat these as quickly as you can. Obviously, again, this person did not make it because this is an autopsy brain, and obviously the brain's no longer in the person. So you want to treat these as quickly as possible. My father had a brain abscess, and they basically had to go into his skull, open it up, go into the brain, pull out the abscess, and give him antibiotics. And he made a full recovery. But that's another one you don't want to mess around with. Spinal cord trauma. We talk about spinal cord trauma. We usually talk about some kind of loss of function, either motor or sensory. If it's paresthesias, it's sensory loss. That means you don't feel things anymore. You don't get that input. If it's paralysis, you don't get the output. Remember, in your spinal cord, information goes up, information goes down. So you may or may not be, you may be paralyzed, or you just may have sensory loss. So you can still move, you just can't feel anything anymore. Talk about paralysis. It's called flaccid paralysis, and that is severe damage where there's no impulses whatsoever going to the muscles. Okay, nothing's going. There's no voluntary control, there's no involuntary control. There's nothing stimulating those muscles. They begin to atrophy. Saw that when you were talking about polio. You guys that did your polio case studies. And you have spastic paralysis. And that means there is some information, okay, there is some information going out into the muscles, usually reflex information. You're not voluntary control, but there is some reflex information. And so you'll just kind of see these random spastic movements. So the muscles don't necessarily atrophy. They're still being innervated. They're still getting activity, but you don't have control of it. So that's the same thing. Basically, it's being paralyzed if you can't control the movement. Last but not least, you have transection, and that's where you take the spinal cord and basically it's cut. And you've lost all your sensory loss, all your sensory information, all your motor information. So this is kind of our worst fear, is having that spinal cord injury that causes us to be paralyzed. If you're paraplegic, that means it's been transected somewhere between T1 and L1. Basically, you can't move your arms. Arms, your legs. Paraplegic is your legs. If you're a quadriplegic, you can't move your arms or your legs. Because the transections occurred in your neck, so everything from the neck down is now paralyzed. Polio. Talked about this in your case study. Basically, those ventral horn neurons are being targeted. So if those ventral horn neurons are being targeted, they can't send that information out, right? No signal. The muscles atrophy. Typically, death occurs because the respiratory muscles are affected. You no longer can breathe, and you go into cardiac arrest. You can survive polio. There are polio survivors, but they may still have some damage because some of those neurons are going to be permanently damaged. But you can survive it. ALS. Amyotrophic lateral sclerosis. We call this Lou Gehrig's disease, after the baseball player. He had Lou Gehrig's. It's progressive, no cure. And it's also a destruction of the ventral ventral horn motor neurons. First thing you usually notice is a lack of the ability to speak, and then to swallow, and then to breathe, and that usually leads to death. It's a very fast progressing disease, typically from diagnosis to death, 5 years. All right, let's talk about the eyes. Because yes, that's part of the nervous system, and you do have problems. We have things called nearsightedness and farsightedness, and that basically means that you've got a longer than normal eyeball, so you can't, the focus length is not right. This is in your book if you don't know the physics of that, but this is just kind of the quick version. Farsightedness, you have a shorter than normal eyeball, and you correct both of them with lenses, with contacts or glasses. Sometimes you have astigmatism, which basically means the cornea is not curved correctly. It may have like a little bump in it, not perfectly curved. And again, you can either fix that surgically or with contacts. If that cornea is not curved, it doesn't refract the light well. Glaucoma, that's a group of diseases where you have damage to the optic nerve, and it's due to an increased pressure in the eye. So that vitreous humor inside the eye, there's too much pressure, and you get something that looks like this. Basically, it looks like a really bad hangover. So basically, there's so much pressure in the eye, it's forcing those blood vessels, and you get this really, really pink or red eye. Diabetic retinopathy, that's a disease that occurs with diabetes. A lot of times we think of diabetes being, your high blood sugar, and you might lose fingers and toes and things like that. But loss of vision is a very common problem with diabetes, and basically you're damaging the blood vessels of the retina. You're killing off parts of the retina, and so you have gaps in your visual field. Basically, your retina is like a TV screen. All that information goes to your retina and basically projects that image on your retina, then that goes to your brain. And so if you kill off parts of the retina, you have gaps, and that's irreversible. Cataracts, that's just a clouding of the lens, okay? And a lot of times that's aging. That just happens as you get older. Also diabetes, common in diabetics, smokers, and exposure to a lot of sunlight, especially with blue eyes. Remember, blue eyes don't have melanin. We don't have that natural sunscreen. So the UV light goes and basically damages our eyes, and we get cataracts. So if you have blue eyes, wear sunglasses. Protect yourself from UV radiation. Smell disorders. Not a whole lot of stuff to talk about. Just there's a bunch of different ways you can lose your ability to smell. It can be anything from a cold, because you don't feel good, you don't smell things, food doesn't taste real good. Could be polyps, you could have damage, a brain injury. It could be a hormonal disturbance. Think about pregnancy. Any of you ladies been pregnant, you'll know that sometimes a smell will just send you over. You can't stand to be around certain smells. Could be a dental problem, could be exposure to chemicals. Think about when you Lysol your bathroom, use Tilex and all that goes up into your sinuses, and you really can't smell for a day or two because you basically killed off that epithelial layer for the day. Could be some kind of dementia. So again, I'm not going to really ask you anything about this. It's just kind of interesting that there's lots of reasons that you may have some kind of a smell disorder. Have different types of hearing problems. Again, anything from blocking the conduction of the sound. The sound waves can't get to the inner ear. Maybe you have too much earwax in there. Maybe your eardrum is damaged. Maybe the ossicles have basically hardened and they don't vibrate like they used to. It could be problems with the hair cells. Those little hair cells have been damaged, so you can't hear the sound. Something you may hear is called tinnitus, and that's a ringing in the ear, and that's really common. Sometimes it's due to nerve damage. Sometimes it's due to inflammation and aspirin. People that start an aspirin regimen for maybe a heart condition, a lot of times will notice a ringing in their ears. Hopefully it'll go away when you come off of aspirin. And then last but not least is Meniere's, and that is a labyrinth disorder. So that stuff, the semicircular canals and the vestibules, okay? There's a problem there, and you basically live with vertigo. And it's vertigo with nausea and vomiting, not a fun thing. One of the cures that they do put you on a low-salt diet to try to reduce the fluid inside the semicircular canals, or they will try to cut the vestibular nerve and try to relieve the problem that way. This is kind of review from what we did in muscles, talk about muscles in the central nervous system. The central nervous system it starts to develop the very first month of development. I'm talking, post-conception. You become male or female really early, depending on if testosterone is pregnant. Testosterone tends to give you a male brain. Lack of testosterone, you get a female brain. Anything that the mother is exposed to really has an effect on the fetal brain. Drugs, alcohol, infections, those can harm the fetus. So anything that you're doing as a mother, you're doing with your baby. So, make sure you're not drinking, not smoking, not taking any drugs that your doctor hasn't prescribed, because all that does go to the fetus and can affect their fetal brain development. Especially smoking decreases that oxygen. So there's low oxygen going to the placenta. The placenta is providing oxygen to the baby, and smoking can cause fetal brain damage. You can probably tell by now I'm kind of an anti-smoking person. All right. Your visual cortex develops in the first 11 weeks. So it doesn't take long for that to occur. But you'll notice a baby, when you first hold them, it's like they don't focus on you because they can't. Within 2 or 3 months, they can see, everything in the room. So it takes them a while for that to develop. If you were to take a child, newly born, cover their eyes for 3 months, they would be blind the rest of their life. They have to have that stimulus in order to develop that visual cortex. Your neuromuscular coordination's head to toe. So remember, first thing they do is lift their head, then crawl, then stand up. So you're coordinating your neurons and your muscles head to toe. As you get older, your cognitive abilities do decline. If you're otherwise healthy, you shouldn't see anything declining till at least your 80s. So, your grandmother may be sharp as a tack and she's otherwise healthy, no problems with brain cognition. Your brain does shrink as you get older. You'll use it or lose it is true in brain. The more you learn, the more you use your brain, the more active it stays. It does help to exercise your brain. And then excessive use of alcohol does tend to cause more accelerated age-related aging processes. All right, I think that's it. Thank you guys. I'm sorry I missed lecture. I hope this helps you guys, and I will see you for the review.